I will call this Community and Public Services Committee meeting to order. It is November 13th, 2020, and this is the edition which we will begin now. Okay, so we are now moving on to item 6.7, the amendment to extend a temporary mandatory face coverings bylaw. We have a number of speakers, and as far as I understand, perhaps some speakers have been added over the break. Is that correct, Madam Clerk? To S. Peterson. S. Peterson.
Mr. Chairman, this is Dr. Hodkinson. I just want to let you know I'm standing by.
Oh, okay. Well, we would love to hear from you. The floor is yours.
Thank you very much. I do appreciate the opportunity to address you on this very important matter. What I'm going to say is lay language and blunt. It's counter-narrative, and so you don't immediately think I'm a quack. I'm going to briefly outline my credentials so that you can understand where I'm coming from in terms of knowledge base in all of this. I'm a medical specialist in pathology, which includes virology. I trained at Cambridge University in the UK. I'm the ex-president of the pathology section of the Medical Association. I was previously an assistant professor in the Faculty of Medicine doing a lot of teaching. I was the chairman of the Royal College of Physicians of Canada Examination Committee in Pathology in Ottawa. But more to the point, I'm currently the chairman of a biotechnology company in North Carolina selling a COVID-19 test. And you might say I know a little bit about all of this. The bottom line is simply this. There is utterly unfounded public hysteria driven by the media and politicians. It's outrageous. This is the greatest hoax ever perpetrated on an unsuspecting public. There is absolutely nothing that can be done to contain this virus other than protecting older, more vulnerable people. It should be thought of nothing more than a bad flu season. This is not Ebola. It's not SARS. It's politics playing medicine, and that's a very dangerous game. There is no action of any kind needed other than what happened last year when we felt unwell. We stayed home, we took chicken noodle soup, we didn't visit Granny, and we decided when we would return to work. We didn't need anyone to tell us. Masks are utterly useless. There is no evidence base for their effectiveness whatsoever. Paper masks and fabric masks are simply virtue signaling. They're not even worn effectively most of the time. It's utterly ridiculous seeing these unfortunate, uneducated people, I'm not saying that in a pejorative sense, seeing these people walking around like lemmings, obeying without any knowledge base to put the mask on their face. Social distancing is also useless because COVID is spread by aerosols, which travel 30 meters or so before landing. And closures have had such terrible unintended consequences. Everywhere should be open tomorrow, as was stated in the Great Barrington Declaration that I circulated prior to this meeting. And a word on testing. I do want to emphasize that I'm in the business of testing for COVID. I do want to emphasize that positive test results do not, underlined in neon, mean a clinical infection. It's simply driving public hysteria, and all testing should stop unless you're presenting to hospital with some respiratory problem. All that should be done is to protect the vulnerable and to give them all, in the nursing homes that are under your control, give them all 3,000 to 5,000 international units of vitamin D every day, which has been shown to radically reduce the likelihood of infection. And I would remind you all that using the province's own statistics, the risk of death under 65 in this province is 1 in 300,000. 1 in 300,000. You've got to get a grip on this. The scale of the response that you're undertaking, with no evidence for it, is utterly ridiculous, given the consequences of acting in a way that you're proposing. All kinds of suicides, business closures, funerals, weddings, etc., etc. It's simply outrageous. It's just another bad flu. And you've got to get your minds around that. Let people make their own decisions. You should be totally out of the business of medicine. You're being led down the garden path by the Chief Medical Officer of Health for this province. I'm absolutely outraged that this has reached this level. It should all stop tomorrow. Thank you very much.